All right, we are live with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey, joins me once again this week to answer all of your COVID-19 related questions. Thank you for joining us, Doctor.
Hi there, and thank you for having me.
So my name is Dilshad Burman. I am a web writer and reporter with CityNews and 680 News, and I will be moderating this chat today. We've been getting questions from people all week. If you haven't had a chance to submit your questions yet, you can do so in this chat right below this live video, and we'll try and get to as many as we can. For now, we're going to get started with the ones that were submitted over the week. Doctor, are you ready?
Let's go.
All righty, let's go. So let's start with a couple of mask questions. Quite a mixed bag this week, but we'll start with these mask ones. LD asks, what is the mask material that is the most breathable? They're concerned about CO2 while wearing a mask, especially for people with lung disease.
Right, so our guidelines say to pick materials, fabrics for cloth masks that are breathable. So something like a cotton or a linen is preferred. It has to be tightly woven. If it's kind of a thin cotton, and it's not going to be able to prevent the droplets. So a tightly woven cotton mask that's 2 or more layers is what we would recommend.
Okay, and then Lorna says, I live in Brampton and I've noticed that a lot of businesses have employees and they're wearing masks that are under their noses instead of covering the nose and mouth. Is this in keeping with the guidelines?
No, not at all. So the mask should cover the nose, the mouth, and the chin, and it should not be gaping. There should be no holes in it. So we have certainly received these kinds of concerns from people that people are not wearing masks properly. And so I think we just all need to kind of remind our peers, our colleagues, you know what, you wear the mask properly, I'll wear the mask properly, and we'll protect each other.
Absolutely. And then Tina has a question about long-term care homes. She says, why is the long-term care workplace still deemed safe when a resident catches COVID-19 from within the long-term facility? For example, a staff member or something bringing it in. Why have the facilities with residents' cases not been deemed an unsafe workplace?
As soon as there's a case that's identified in a long-term care home, it can actually be a staff or a resident. Automatically, with one case in that facility, it's actually declared an outbreak. And what that means is that there are already added public health precautions for day to day in the long-term care homes. But when there's one case identified, now the precautions are increased. And so that's what continues to make it a safer place, because there's more PPE requirements, there may be more cohorting, depending upon the situation. Residents may not go down to eat their food, they may have dine-in service in their rooms, for example. So there are a number of interventions that are put in place when a case is identified to continue to enable that the residence is safer, continues to be safe. These are places where people live, and so we have to do what we can, because they actually don't have choices in terms of that is their home. And so we have to make sure that their home is as safe as can be.
Absolutely. And I think, declaring something an unsafe workplace, you can't just abandon people who live there. They're still, maybe the workers can't come in, but the people that live there still need help and still need support. So I don't think it's just as simple as declaring it unsafe. And then what do you do with all the people that live there?
Yeah, and I think the question is, what is unsafe about it? Because with PPE, we know that we can actually be quite safe with COVID. And so I think that's another thing to consider, that just having one case doesn't make it unsafe. It means, okay, well, now we're already wearing a mask, but we need to now wear more PPE or wear it in this fashion. So I think that, we just have to modify what we do in the workplaces to continue to allow them to be safe despite the circumstances.
Right. And then Patrick says he drives a public transit bus and is asking, what is the best way to protect himself on the bus, especially when it comes to things like ventilation? Should he keep all the windows open? Should he wear, a more protective mask? What are the guidelines?
So for the bus driver themselves, many of the buses actually have the plexiglass barrier, and that's actually an excellent way to protect a bus driver. I actually think a bus driver has actually one of the most protective jobs when that plexiglass is there, because you can't always maintain that 6 feet distance for passengers that come and go, but you have that physical barrier. Wearing a mask though when you're driving is also helpful. Washing your hands, all of that. Certainly keeping a window open is not a bad idea, especially if you can tolerate it with the weather. And keeping some airflow within the bus for your passengers is also helpful as well.
Okay. So Glenn has an interesting question. He says, it's been 5 months and we had no mask, and then COVID numbers were reduced. Over the past 2 months with the masks, he says that we're looking at a second wave. Do you have any information on what we can do to help the human immune system fight off this virus rather than waiting for a vaccine?
Well, I think it's an infection, and so in order to fight the infection, classically you need antibodies, and so that means getting infected. The way to prevent that getting that infection is to actually prevent getting the virus inside you, and so that's why you see all these public health measures like wearing a mask. I was actually reflecting, in February, the beginning of March, we were not recommending masks routinely, and we didn't quite know what we were dealing with this virus. And now we're in a place where we actually know what public health measures are effective, what can be effective, what we can do to help live with the virus. And so I think we certainly want people to stay healthy. The healthier you are, the stronger your immune system, the more you will be able to fight the virus if you are infected. But as a public health doctor, I always think that the best thing is actually prevention. Preventing getting that infection will be really key to start.
Absolutely. And I mean, preventing the infection from getting into you in the first place, we follow all the measures. Wash your hands, don't go out if you don't need to, wear the mask, the things that we've been saying for all of these months, right?
That's right. But to the person's question as well, though, is that should you get infected, being healthy is definitely going to be important to help you recover faster, to not have severe complications for sure as well.
Absolutely. This is an interesting one. We've got 2 different questions about this. The first one is, Tezin asks, I have workers finishing my basement and I noticed that they don't wear masks while they're working. Our living areas are completely isolated from the entrance of the workers. We never get exposed to them at all. But is there a risk for my family, considering that it's a small townhome, and if anyone is sick in the basement, will the virus, circulate through the air conditioning system? Is there any risk of anything like that?
Okay, so that's a good question. And it's about, well, how is the virus spread? Is it spread through ventilation systems? Right now, we don't think that the virus is spread through ventilation systems. And I always say right now, because we're continuing to learn more and more about the virus, airborne spread in a community setting is not considered a predominant way or even known to spread the virus. If you had close contact with the workers and they weren't wearing masks, well, that I would say would be a risk. If they were working in your basement and then after they leave, you go down into the basement, I would certainly recommend that you do cleaning and disinfection because the surfaces could be contaminated. I think in general, though, keeping windows open, like allowing additional ventilation is not a bad idea and can be supported. But I don't think that you have to be worried that the air in the basement, it could be contaminated and can come up through the vent system and infect you. There has been no evidence for that kind of spread. The kind of spread that we've seen related to air is, for example, an air conditioner or say a fan where someone is sitting here, someone is sitting there, and then it's blowing air and that air is blown with the droplets onto someone.
Right. So kind of like you're upwind of them and it hits you in the face.
Yes. Yeah, exactly.
And then the related question is it safe to have workers in a small condo? My building has undertaken extensive plumbing repairs, which are going to last for up to 3 months. And each unit is going to have workers there for 5 days or more. I'm worried that they will bring COVID into my home, and it's such a small space. And now everybody's working from home. They have nowhere to go.
Yeah, so I think that definitely this requires some attention, because I think that if you're going to have workers working in your space, you want to make sure that there's public health precautions. So you want to make sure that there is that 6 feet distance between you and workers. You want to wear a mask. You want them to wear a mask. You want to even make sure that they're not sick when they come into your place, and make sure that your building management has those protocols in place to make sure that sick workers are not working. Hand sanitizer is available. I think if your space is so small that you cannot keep a 6 feet distance while people are working, then I would suggest that you find another place to work, because that would be a higher risk situation. Even if everyone's wearing a mask, I still think it's safer for you to be in a place where you can maintain that 6 feet distance. I would say though that after the workers leave, you would want to clean and disinfect the surfaces that that could be contaminated, and make sure you wash your hands after doing that.
Absolutely. And this is a not related, but kind of small space question. Andy says, I have been scheduled to write an indoor exam for 6 hours in December this year with other candidates in the same room. Do you think it's unsafe to proceed with this exam? And what are the precautions I should take if I do end up writing it?
Okay, so we have actually reviewed some of these plans that people have for writing exams. If what I would say first off is a 6-hour exam. Good luck. But also you have to make sure that they are going to keep the desks 6 feet or more apart. And I think you would want to find out from the examiners, people, they should be wearing masks. We're certainly recommending masks in indoor spaces. So despite the fact that you're writing exams, keeping 6 feet, each desk 6 feet apart or more, and wearing masks, they should have some sort of screening to make sure that if someone is sick, they are not coming to write their exam. There will be a way for them to write it at another time. They won't be pressured to write it. And that I would keep hand sanitizer there. That's what I would suggest to make that a safer condition.
Right. 6-hour exam. You're right. Good luck on that for sure. And I have nightmares about 6-hour exams. All right. This is from one of our 680 News listeners. They say that Ontario has started pooling samples of 3 to increase testing capacity. And it looks like if one of the tests is positive, then all of them are the other 2 are also positive. So this would mean that the number has gone up a lot based on false positives. Can public health explain this method?
Okay, I'm not sure that the numbers have gone up based on false positives by this, but what it means is that if you have 3 tests, instead of doing each test separately, now you're putting them together and putting all the tests in to be tested. And if the pooled test comes back negative, it means that all 3 samples are negative. But if the pooled test comes back positive, well, you don't know which of the 3 samples is positive. So then you have to pull that batch out and do each individual one separately to find out which one is positive. So that's the thinking behind pooled testing. And right now we're doing batches of 3 to try and kind of, the idea is to gain efficiency. If you could do a batch, they're negative, you put it aside and you move on, then, even over 30, that's 10 less times, only 10 times you'll have to test groups compared to 30 times, for example.
Right. So if a sample comes back positive, they're not going to assume that all 3 are positive. Then they're going to pull them out and test each individual one, correct?
That's right. And there will be lab mechanisms in place to make sure that there hasn't been contamination, so that those 3 original samples are still there. They haven't cross-contaminated and they can be tested individually. Yes.
Right. I think because as a layperson, when you read something like that, you think they're just like mixing all the samples together in one petri dish and, putting it down there, which really would make no sense.
That's right. And I think it's important to note that these are kind of sophisticated molecular tests. So they're kind of going into a machine to get read, different from like a petri dish watching kind of bacteria grow. Yeah.
Right. Exactly. Okay. So Ron Moore asks, Dr. Dubey, what is the end game with COVID-19? When will we sound the all clear? How long is it going to take? Because experts say that COVID-19 is more contagious than the flu, and the flu has been around for decades, and so will COVID-19 apparently. So when it comes to a vaccine, even a lot of people might not be taking it. 40 to 60% of people generally don't feel like taking the vaccine. So what is the end game then? What is your best guess in terms of how we're going to do with COVID-19 in the long run?
Yeah, it's a good question. I don't think that we really can predict a lot. Like, I can't even predict what the fall is going to look like. I think, we're trying to get through the fall. What I can say, though, is going into the fall, we're in a different place from where we were in the spring. In the spring, we had to shut schools down. We didn't know how to open schools and make them safer. Now we have a sense, well, these public health measures actually work. We actually have very good examples, something from as extreme as the NHL bubble to the essential workplaces that have been opened throughout the pandemic. So we know that there are things that we can do to help prevent the spread. By preventing the spread of COVID, we're actually also preventing the spread of other respiratory viruses, which I think is really good. And so you'll know with flu, like we have a vaccine. While not everyone gets it, it keeps those people who may have severe complications from it less sick. And so I think that that's part of the end game is if we have a vaccine where we can protect our vulnerable, who are more likely if they get COVID to die or to get very, very sick. Those are the people, that's part of the end game, to be able to help protect them from getting sick.
Absolutely. I think that's a good way of putting it, just keeping as many people alive as we can.
Yeah. And we have to recognize that if we just let things go, we've seen some countries that have taken, similar approaches, and it puts such a strain on the healthcare services. If you're very sick, will there be an ICU ventilator for you to help you recover? And those are difficult choices. That's a very difficult situation to be in as a society. And so that's another real motivation for kind of really slowing the spread. Until we can sort things through, on the best next steps.
Absolutely. And I think one of the things that we've talked about before as well, when it comes to flattening the curve, it's not just about like getting case counts down to zero. It's also about not overwhelming our healthcare systems, like in order to keep the curve at a certain level so that we have enough ICU beds and ventilators and things like that. I think that there's a misconception that flattening the curve just means getting rid of COVID altogether.
That's right. And you'll see in the summer, I mean, our cases were quite low, but they never did hit zero either. And so I think that's another piece in what the end game looks like. And that's with precautions in place, right? But people have loosened their precautions, and then you see the numbers go up. And so I think that also tells us that's why we can't just say, okay, just let it go, because even with some precautions in place, and some people not following them fully, we're seeing the numbers rise. So
right, absolutely. Okay, so we've got a couple of testing questions now. Dhaval asks, how can someone get tested for COVID-19 even if they are asymptomatic?
So the recommendation really is that you get tested if you have symptoms, even mild symptoms, like even a stuffy nose, a runny nose, a sore throat, a cough. Something that's new, get tested for sure. If you have no symptoms, but you were in close contact with someone who had COVID, so either you got a ping on the app or, one of your friends who you didn't physically distance with got COVID, well, that would be a recommendation to get tested. We're not recommending that anyone without symptoms get tested. I mean, there are some workplaces where it's required, like we talked about long-term care homes to start. They are required to get tested when they're asymptomatic, but we're not recommending it routinely for everyone. And I think part of it is related to what are you going to do with the results? How often is it going to be positive? And then also kind of saving the lab capacity. We've seen with schools opening, kids have some of these symptoms and they need to get tested. And so we want our lab capacity right now to be utilized for people who have symptoms first and foremost.
Right, absolutely, right. And like you said, I think you've mentioned this so many times during our chats now, the test is good only for the day of.
That's right. And so there's also this concern that people who are asymptomatic are getting tested and using it as a badge of clearance. Okay, I'm clear. Now I can go away to that cottage, or now I can go to that friend's party. And that's certainly not the way that the test is intended to be used.
Right, absolutely. Because it's also just not a one-time thing. It's not like if you don't have it, you don't have it and you can't catch it. You can catch it after.
That's right. Right.
And so the next testing question is from John. John says, I have type 2 diabetes. Should I get tested for COVID-19?
So just because you have type 2 diabetes doesn't mean that you should get tested. But if, again, you have symptoms, your symptoms were worse, even, in someone who's diabetic, if they had kind of trouble breathing or were more confused, maybe even more tired, those might be signs that you might consider getting tested. But just because you have diabetes and no symptoms, no exposures, I wouldn't say that you need to rush off and get a test.
Okay. And then the next testing question is about antibodies. We haven't had one of these for a while. Sue says, I would like to know if I can get tested for antibodies because I had a very serious flu earlier this year.
So the publicly funded antibody testing is only available for select situations. I have heard, though, that some of the labs are offering for you to get an antibody test that you can pay for. So that is an option. I think what we have to be clear on, though, is what are you going to do with those results? There is some indication that the antibodies are actually, from a science perspective, B cells. And so they will tell you whether you have antibodies. But just because you don't have antibodies actually might not mean that you either didn't get COVID or that you don't even have immunity, because there might be more of a component of what we call a T cell response. And that's not picked up in an antibody test. And so I think that's part of what we have to think about when we go for an antibody test. What is it that we're going to be tested for? Are you curious? Did you have symptoms a month ago and you're wondering whether that could be COVID? And if you find out that you have antibodies, what are you going to do with that information?
Absolutely. I think for a lot of us, it's curiosity for sure, because as a layperson, as just somebody who's, in the community, even if I have the antibody, what am I going to do with them? I can't offer myself up. I can't do anything, even if you want to help with the best of intentions. As of this point, there's nothing in place for you to do anything to help, right?
That's right. And it's not like, okay, now you have antibodies, you can specifically donate your blood or something like that. Okay. So, I mean, there are tests being done for people who donate blood to see if they have antibodies, but it's not the other way around. I have antibodies now, you're recommended to donate blood, for example.
Exactly. So this is some flu-related questions. Stevie asks, is there any chance the virus cell could mutate with the flu cell and make it a super virus?
You know what I would say is anything is possible, really. Science is really intriguing. And I think these bacteria and viruses, we can't even see them. Some of them aren't even alive unless they're in a host, like a virus, and they can do all kinds of things. And so I think, I'm certainly, that's not my area of expertise, that, kind of basic science stuff. And so, but I would say that even looking at COVID, some things in science you really can't predict fully right to the end. We've always talked about pandemics, but we talk about pandemics with a flu virus, and now we have a pandemic with a coronavirus. Yeah,
it's a mystery. Absolutely,
yeah, exactly.
Yeah. Okay, and then this is a related one, I guess, to the flu. If you have the seasonal flu, but you get tested for COVID-19, will that test come back positive for COVID if you have a flu?
No, so it will only be positive if you have COVID. And so the test is, again, this molecular test, and it looks kind of for pieces of the virus itself. And so right now, there's no indication that there's any cross-reactivity. That's kind of our medical term for saying, well, if you had the flu, you didn't have coronavirus, but your coronavirus test came back positive because it was the flu that was reacting to it. There's no evidence that that's the case. And so again, this is a wait and see. In long-term care homes, for example, if someone has symptoms, we will be testing them for all of the viruses, not just COVID, not just the flu. And so we might be able to look into that a bit further as well.
Right. Okay. This is another one. T asks, I asked my family doctor, what are the exemptions when it comes to wearing a face mask? And how does one qualify for exemptions? He says he hasn't been given any guidelines from the Ministry of Health.
There are no formal guidelines for exemptions. I think it's up to each individual. You can't say that every individual who has asthma automatically gets an exemption. Everyone who has COPD gets an exemption. In the emergency department, I see people who have breathing difficulties and can wear a mask just fine. So I think that's why you don't see kind of a list of these conditions automatically get an exemption. And I think that's why it's very good to have a conversation with your doctor to find out, is it safe or not safe for you to wear a mask? I mean, sometimes it's just about finding that mask that fits you, or wearing it the proper way, or practicing wearing the mask if you have another condition.
Absolutely. And then a ton of school questions as usual. So we'll get to the school questions now. Julia asks, do I need to be worried about my child's exposure to all of the cleaning chemicals that are going to be used extensively this year? And what are the health risks related to that?
So the cleaning chemicals have been approved by Health Canada, the ones that are being used. They're certainly not being ingested, and certainly before children eat, they are, washing their hands or sanitizing their hands. And we focused on kind of keeping the windows open as much as you can to let any kind of fumes out and to increase the ventilation that way. So I'm not aware of any concerns about the cleaning chemicals and their impacts on children.
Okay. And then Andrew and Brett actually have a similar question about class sizes. Andrew says, do you think that class size matters in order to keep the virus in check and protect students and families? And then Brett says, for classrooms that are at a cap of 27 and they're not being reduced in size, do you think that the kids are at increased risk?
Okay, so one of our most important public health measures is physical distancing. And we've said that even for schools, we've said that, everywhere. And we still say that, like in schools, we want as much physical distancing as possible. 2 meters is best. If you can't do 2 meters, plan for 1 meter. Some distance is better than no distance. And so I think that continues to be our recommendation. Just this week, in a meeting that I had with the Ministry of Education and our Toronto school boards, we said that continues to be, from a public health perspective, what we recommend. Noting that there are also many other public health measures that are in place in schools beyond physical distancing, which are very good measures as well. When you think about a class size of 27, well, if it's in a big enough space, that could be considered safe. So part of it is not just about the class size, it's also about how big is the classroom and making those determinations as well.
Okay. And then Shadia asks, in high schools, my kids tell me that the corridors are the most problematic areas in the morning when kids are trying to get into their classrooms. Sometimes the classes are not even open and then they just crowd around outside the classrooms. How is this being mitigated when it comes to public health measures in schools?
Okay, so I think if that's the case in your child's high school, you should mention it to your principal. In our public health guidelines, we talk about having one-way directions in hallways, not congregating. Congregating certainly is not something that we are recommending. Making sure that kids, wherever they are, can maintain that distance as well. So if you're noticing it in particular schools, please do raise it with the teacher or the principal to say that, is there more that they can do to address this?
Okay. Let's see. William asks, what's the mask recommendation for kids? From what age should they be wearing masks in school?
So that's going to depend on what school you go to, what school board you're a part of. The Ministry of Education has required masks from grades 4 and up. Toronto Public Health has strongly recommended masks for all students in school from elementary and up. The Toronto, 2 main school boards in Toronto have required masks for all students. Masks are not recommended for under 2 years of age, that's for sure. If you can't put on a mask or take it off on your own, a mask is not recommended for that student as well.
Okay. Okay, so it does depend a little bit on the individual school as well.
That's right. So, because I know that some people listen here and are not part of the City of Toronto, some other areas outside of the city have different requirements for their school boards.
Right, absolutely. And then I'll just squeeze this in. We've had this before, but it is good to reiterate. Fred asks, why are there no biohazard waste bins distributed throughout the schools and municipalities, given that COVID is so infectious?
Okay, so yeah, I mean, that's a good question. So what we know is that from our, scientific experts at Public Health Ontario, they have recommended that things that are soiled with the virus, like someone who has COVID, their tissues, their, whatever their waste is, can be thrown in regular household waste in a lined garbage bin. And if you touch any of that waste, you wash your hands afterwards. And so part of the reason for that is because we know that once you throw it in the garbage, the virus will last, depending upon what you're throwing out, like whether it's a tissue or whether it's a piece of paper, whatever it is that's contaminated, will last for maybe 72, maybe 96 hours max, but the virus will die. And so as long as people are not rummaging through the garbage, once it gets to wherever it's going, there will be no live virus for it to continue to propagate or infect others.
Okay, and with that, we are at 1 o'clock. Thank you so much, doctor, for taking the time once again and answering all of these questions. I won't keep you any longer, but we will see you next week.
We'll see you next week. Yeah. Okay. Thanks.
All right.
Bye.
Thank you. Thank you, everybody, for joining us.